Well, hello, everybody. My name is Michelle Shippey, and I am the Executive Director with the Healthy Hoosiers Foundation. I'm excited to be here today and share a little bit of information about the foundation, um, when it began, how it began, the purpose of it. Many of you may not be aware of it. It has been around for a long time. But I will just first start with a little bit of an introduction of myself. I have been with the Indiana Department of Health prior for about a year and a half as the Food as Medicine Director. My expertise is in nutrition, food access, food as medicine. Previously was 16 years with the Marion County Public Health Department, started in the WIC program, and then went into chronic disease. So public health has been the work and the space that I've been in most of my career, and most recently moving into the executive director position in July of last year for the Healthy Hoosiers Foundation. So just real quickly, the mission and vision of the Healthy Hoosiers Foundation, we are very in alignment with IDOH and its priorities, which I will go into more details on that. But our mission is the Healthy Hoosiers Foundation assists the Indiana Department of Health and its partners in improving the health and wellness of individuals and communities across Indiana. And our vision is a healthy and safe Indiana supported and sustained by thriving, engaged communities. So, a bit of background about the organization is the organization was actually started back in 2020 or 2013 when it was introduced into legislation to be a non-for-profit organization to support the agency as a subsidiary organization. It took a while, about as far as timeline goes, about a year once it passed to then actually be incorporated. And so in 2014 is when the foundation actually became a 501c3. And then in 2015 is when there was a big launch at the time with Governor Holcomb and Commissioner Adams, where it was really focused on supporting infant mortality work. And that was a event and fundraising event to start really leveraging dollars that are going to fill the gaps around public health. It allows the organization to be able to solicit donations, fundraise, apply for private grants that then can be provided as a funding source for IDOH and also its partners, including local health departments. We do have representation from IDOH on our board. So our health commissioner, Dr. Weaver, and also our chief of staff, John Ferguson, are board of directors for HHF, as well as we have 6 other board of directors that represent, and all of them are appointed by the governor's office. So a little bit of overview. When it comes to the board, our board members have 2 to 3 year terms. And really, as I mentioned, the leadership role of the foundation is to be able to fundraise and grant management around private foundation grants. Now, currently, that is what we do the most of, and which I will talk a little bit more about as we're in a strategic planning process right now, how we are going to create a robust development plan around how we could potentially do some campaigning and bring in additional funding for public health to really align with the priorities that we come across within our strategic plan. But we can also really partner community partnerships and outreach to really amplify IDOH. This allows us to get out in the community and do some engagement, specifically, with funders, going to events, really building our partnerships that we have across the state. And then the current priorities that we really do focus on is infant mortality, maternal health, childhood immunizations, tobacco cessation and prevention, HIV/AIDS, mental health, chronic disease prevention, and also food and nutrition work around the state of Indiana. Again, here's some of the benefits. We like to kind of mention being able to be more nimble in regards to getting contracts through, having as a resource if we need something that needs to be done a little bit quicker. And also being able to leverage those dollars that typically may not be able to go through a governmental entity or a unit. So where HHF can take on those responsibilities. And then how it works from there is we subgrant to IDOH. Then we have that contract between IDOH and that particular division and program area where we can move the funds or we can actually hold on to the funds, really depending on the particular project that's going on. And also the various resources and sources and services that they will be using. Again, as I had mentioned, we can build those partnerships. We really act as a catalyst for public health across the state. And we are the Public Health Institute for the state of Indiana, which I'll also go into a little bit of details on that particular network. This might be a little difficult to see. It's kind of small. I did provide, these slides will be shared. But here's really where we've drafted up moving forward as we do our strategic plan, sort of these 6 pillars around what our development plan would look like. Number 1, fundraising. How do we expand upon just applying for grants to also potentially do events or capital campaign and really start building a public health fund to support the state? We also will continue to seek the grants. A lot of times that happens either HHF will look for grants based on needs, or a division or program area within IDOH will actually find something and they'll send it to us. And then we will go ahead and create templates and package everything together and submit it through HHF on behalf of IDOH. Internal program support, I already mentioned, those are sort of our priority areas currently. Public Health Institute will continue to leverage that network to be able to receive resources, technical assistance, and we can really expand upon that, which I'm excited about. Communications, bringing more visibility to the foundation. So doing things like this, this is actually it's my second presentation around HHF since I've been in the position, but being able to bring those visibility around the organization and what we're doing. Continue to build collaborations with other foundations, other organizations, other funders. And then lastly, being able to really evaluate and have evaluation around the foundation and what we are doing. Our next phase is creating a dashboard so that we can, and also revitalizing our website so that we can have something for the public and to access and be able to see a little bit more about what the foundation is doing and how you could even support us. So now I'm going to jump into some of the strategic areas and projects that we have been working on. As I mentioned before, our priority and focus areas are all driven by IDOH's priorities. And so as they go through strategic planning and as they go through identifying what those priorities and focus areas are, HHF aligns with that. However, that we do have the flexibility doesn't mean it has to be a very specific focus area. It can really expand on whatever the need is within the agency. This may include technology. This may include workforce. In some cases around our food as medicine work, this may include the cost of food. Where are those funding gaps that we're seeing in public health, especially as we've seen federal cuts, reduction in Health First Indiana, like those sort of things? How can HHF be able to support the work that's happening? And also within the Rural Health Transformation Program, and really the implementation of that, HHF is here to also really assist where we can there and be able to fill any of those potential gaps of funding that we can to support that for the next 5 years. Here's just a list in regards to how we also can support our local health departments. And, as I mentioned with the recent reduction in funding for HFI, a lot of our divisions and agencies, they do work directly with the local health departments. And as HHF as a foundation, we can also do any contracting with local health departments for any particular programs, services, or projects that they may be working on, which we know then trickles back into the community. A lot of the work that's happening within their counties or maybe even within the region and collaborations that are happening, that we can continue to work and support the local health departments in that space too. So if they were to see something that was an opportunity for them, that we would be able to leverage those for them. So here's our current projects. We have right now Builders Vision. They are our funder for our food is medicine work. That's been a 2-year project. And we're hopeful that we'll be able to continue some funding there to keep the work going around food is medicine and really building the infrastructure of what that looks like across our state. Really defining having a definition of food as medicine that's universal across the state, really standardizing intervention types, such as a produce prescription program. And also, how do we build the workforce, find the funding to support food cost, and also the sustainability around those types of interventions in regards to various policy pathways. We also do a couple scholarships. We have the Bree Wilson Scholarship. That one is through our tobacco prevention and cessation, and that is provided to a senior who is out really advocating around tobacco prevention. And then we also have the Hester Schultz, which is $1,000 a year as well, and that one goes more into like the graduate level in regards to the advocacy that they do around tobacco cessation. Most recently, we received funding through the Gilead Focus program. And this particular project is going around to 6 county jails and doing HIV, STI, and syphilis screenings for those individuals that will be leaving the system and coming back out into the community. And we're really excited about that project. We're hopeful too. That's another one that we'll continue to move forward with, especially as we see a lot of federal cuts that have happened in that space. So we're very fortunate to be able to support that division in this work. And then the last thing is we do provide very minimal, but we like to provide some sponsorships. This year, we sponsored the Celebrate Science Indiana for our laboratory services. And that's where the picture there to where there's a lot of youth that come to that event and really educating them about getting into careers around lab work, public health as well. So we continue to make that a priority to be able to support and also, bring some visibility around the foundation. And as I mentioned, the Healthy Hoosiers Foundation is the Public Health Institute for Indiana. It's only been established for the last couple of years. And so with me being new into the role, I'm really excited to continue to engage with the network. But they're there to really provide technical assistance and support around strategic planning. There's also funding opportunities that they typically will share with each public health institute. I'm part of the planning committee with the various conferences. There's about 6 of us going to that in April, which is the 25th anniversary around the Public Health Institute, where we can really collaborate with other public health entities across the country and really providing that networking opportunities. I know that was short and sweet. At this point, I just really want to open it up to any questions that people have. Or Carolyn, I'll let you take like the next move. But I really appreciate the time to be able to share a little bit about the foundation. And hopefully in the future, I'll be able to share more and where we are advancing and really revitalizing the foundation and being able to support public health across the state of Indiana. And then there's my contact information available there too. I will just share just some other things that make the foundation very unique from other foundations is that we are, we have requirements because we were created under statute. So we do have annual reporting that we have to provide to the state budget committee. Um, Anytime we have any sort of reinstatement of board, that all goes through the governor's office. So there is some legislative phases that and requirements based on the statute that the foundation has to do. Um, but we're very transparent. I think that is what is really great as well. Um, and like I mentioned, we're just really excited to see where the foundation can go and really reach, its capacity and opportunities that is available to them. I'm really curious as far as like representation on this webinar. Um, who are the participants and attendees? Is it within like the public health space, specifically rural health? I know I get a lot of when people first learn of the Healthy Hoosiers Foundation, they're kind of surprised. They're like, "Oh, really? That exists?" And how did that even happen? Yeah, and we're hopeful too, like being able to get connected to other association and memberships. For example, the Indiana Public Health Association. Oh, that's awesome! I was just reading. Meredith gave the first donation into the original HHF. Well, thank you. We are actually also building capacity within the organization. We will be hiring a project and grant manager position. Traditionally, it's always just been the executive director that's been a part of the Healthy Hoosiers Foundation. But as we continue to see the growth in our support for the agency and really needing somebody to help support the projects and grant management piece of it, we're just really excited to be able to add another team member. And I will also mention some people will ask questions around how does HHF connect with IDOH, but also how is it sort of its own entity? We are our own entity as a 501c3. We're a type 1, which means that we are a charitable nonprofit organization that supports another organization. And so in this case, it's IDOH. But we have all of our own, we do all of our own financing and accounting and program, those types of things ourselves. But we are connected within IDOH as they support actually my position as a state employee and many other like technology, workspace, those sort of things. So there's really just a collaboration between the organizations based on that statute. Yeah, and Paul Haverson was on the board from the very beginning as well. Let's see. As part of the work, we're launching a food as medicine pilot in a couple of counties this spring. Yeah, and about the food as medicine, I see a couple food as medicine questions on here. So our division of nutrition and physical activity, which I'm still the interim director. So you can definitely reach out to me for any questions around food as medicine. We are in the hiring process of a new director, which is really great that you're looking at launching a couple in the counties this spring. If you have any particular questions on really designing them, including looking at what populations and patients you want to reach. I'm happy to actually sit down and have a conversation around it. One of the big goals that we have this year is putting an implementation plan together, which that includes really diving into how do we really bring standardization to these interventions, specifically talking about like a produce prescription program. Like, what is their duration? How do we get universal food insecurity screening within the healthcare systems EMRs? How do we get some sort of closed loop referral process from the healthcare systems to the food provider, depending on who that food provider may be? It may be a food bank, it may be a local food hub, it may be a card system, where participants and patients are shopping on their own. And then what's the dosage? Like, how much produce are they getting? And right now we see majority of our programs and interventions focused on chronic disease. So individuals that have prediabetes, diabetes, hypertension, but we are starting to look into maternal health as well and perinatal, and really kind of going through that life cycle. So more to come. But again, IDOH and the Division of Nutrition and Physical Activity is completely open to helping design and answer any questions around the interventions themselves. That's the one thing I would say is, with food as medicine, that's really the term for kind of that broader umbrella, but really defining what type of intervention you're actually wanting to do. Is that a produce prescription program? Is it a medically tailored grocery program? Is it healthy groceries? Or is it even medically tailored meals? Which those tend to be more in collaboration with organizations that are actually creating the meals, and they're being delivered to patients that were, maybe recently discharged from the ED or the hospital, and really trying to reduce readmissions. Perfect. Thank you, Meredith. And the interesting thing, one of the biggest, it's being funded by Rockefeller Foundation right now. One of the biggest produce prescription programs that is happening is within the Veterans Administration at a federal level. It hasn't came to Indiana yet, but I would really like to see it, be in Indiana at the VAs. Do you anticipate developing a single food as medicine program to be utilized by all entities? Yeah, Gail, that's a really great question. I think the most promising one are produce prescription programs, especially within our obesity and chronic disease plan. As Indiana is working on that, the main criteria for that is food and nutrition insecurity, along with having at least one chronic disease. And what we're really seeing is the impact of adding fruits and vegetables to an individual's diet, especially when they don't have the resources to actually purchase them themselves, has really improved health outcomes. When you start getting into more of like a medically tailored groceries, where you're getting more than just produce, so you may be getting protein, you may be getting, now beans and legumes, they actually are a part of produce prescription programs, so those can be included in there. Maybe dairy products as well. Those are a little bit more tailored around certain populations, like maternal health. And the one thing that we always really emphasize too with these interventions is that they are still supplemental. They're not going to be like a complete meal for individuals, but it's providing them the most fundamental food that we know can support good health, which is fruits and vegetables. But also, we really are focused on layering a lot of these interventions, especially for individuals who may be participating in nutrition assistance programs like SNAP and WIC. We also have our Double Up Indiana program, which that happens at mostly farmers markets currently. We have about 51 sites across the state. And those are for families who are on SNAP, where they can go to a farmer's market or they can go to retail in Fort Wayne and Marion County. They have some retail options where they can double their dollars to get fruits and vegetables. So we're really excited about that program. And I hope that answers your question, Gail. I think specifically it's produce prescription programs where we're going to have much more of a standardization around what that looks like. Oh, yeah. I know, and we really want to stay in contact with Wabash Valley on that work as we continue to leverage more funding. And actually, the funding that they did receive was the health disparities, the CDC grant funding, which unfortunately kind of got cut right away. But as we continue to leverage more through Builder's Vision, we're hopeful that we can have more programmatic funding, specifically the food cost. Like that's the biggest challenge that we see, especially when we see even some federal, like HRSA recently has like $15 million that they're putting towards produce prescription program for maternal health. The CDC will sometimes, bring some money in, but they're always restrictive to the fact that we can't use it for food. Like, but that's what we need it for the most. So again, the Healthy Hoosiers Foundation is another avenue to where how can we support the food cost that we know is in some cases is going back to our local food economy. It's going to our farmers. And even if our farmers are sourcing to other food providers like food banks or to grocery stores where those incentives are being used, it's still going back into our local food economy. Let's see. Perfect. Kind of fortunate when the grant ended. Well, thank you all for the questions. And also look out for more information around the foundation. Again, as we move towards, looking at some campaigning and maybe even for specific projects, I have heard from a few of the division areas where they may need some fundraising support. We're really excited to be able to help do that, and seeing what that may look like. Many of you being in public health, in my mind, public health has always been kind of behind the scenes. We've always received federal funding and it's like, oh, they're good. They don't need any money. But now in this time with uncertainty, we do. And it's like, how do we start to build those private public partnerships and show that it's not just about health, it is community impact, it is creating a safe and healthier community for our residents across the state. And so as we continue to kind of bring that visibility and around public health and start to engage with more funders to realize the support that they could provide, I think there's a lot of great opportunities.
Great information.
Wonderful.
Anybody else have any other questions? All right. Well, looks like you've answered everybody, and I just want to thank everybody again today for joining us and have a great day.
Thank you.